Welcome to our town, everyone. And how much time do I have? And before I get to the end of that time, would you cut me off and tell me to address the second issue that I think is as critical as the first one I'm going to approach?
I think you're good for 10, 15 minutes or more.
Okay. All right, thank you. I'll be succinct. I'm not going to read the legislation. It's available on the website. I'm going to tell you some bullet points on the federal legislation that we put together, both the House and the Senate. It's called CARA. That's the acronym we give it. It's the Comprehensive Addiction and Recovery Act, C-A-R-A. This is legislation that was put together not only by the Democrats and the Republicans in the House, but the Democrats and Republicans in the Senate, and combined. We went into conference. I was part of this from day one, and I will be part of this until we get this problem resolved. Many people wanted to be part of this. I think the whole Congress, the House and the Senate. They selected a few of us because of our prosecutory background, others because of their medical backgrounds and their law enforcement backgrounds all around. But what CARA does, it's clearly not enough money, but it's a start. It gives, creates grants, for the most part, for local and state law enforcement to the tune of $103 million over 5 years. We could spend that in 6 months to really tackle this problem. But it expands the cooperation between the federal government, the state, and the local government. We've never had a situation before where we brought in people from all walks of life concerning drug addiction. When I was a district attorney, we had a crack cocaine problem here in Lycoming County. One of the things that we did is we asked the feds to come in, and we worked very closely with the DEA agents and other law enforcement, ATF, because guns are always involved. But we brought in the state law enforcement and the local law enforcement. But in addition to people that we met with on a regular basis, there were physicians, there were psychologists, psychiatrists, there were nurses, there were PAs, there were lay people from the community, religious people, families that have been affected by this, recovering addicts, and we pretty much covered all the bases as to what do we need to do to correct the cocaine problem, the crack cocaine problem, and I think we should perhaps take a look at that approach from on the opioid problem that we have. I brought a lot of this information to light when we were in conference between the House and the Senate. Everyone seemed to be receptive about it. But I introduced 2 pieces of legislation in this comprehensive, and I don't like that word comprehensive because we think it's a silver bullet, that it takes care of everything. It doesn't. But I added 2 pieces of legislation to this myself that we got passed in the House and the Senate and as part of this package and signed by the President. Two areas. One was, we at the federal level not only deal, of course, within the boundaries of the United States, but around the world. We have DEA agents, FBI, ATF, all around the world, concerning a myriad of problems, but particularly in the drug area. And there was a loophole in the prosecution where we had a rough time prosecuting individuals, organizations, cartels, concerning the precursors, the chemicals used to make drugs. And this was all part of the cartel, but they had slick enough lawyers that got through the loopholes of old federal laws. And what it boils down to, there are certain chemicals needed to produce cocaine, heroin, and also pharmaceuticals. And part of the cartels, they learned to get into this area rather quickly. They had, I would say, subcategories of their organizations producing these chemicals and then sending them to other countries, sending them to places where they manufacture the drugs, and also stealing these from, in transport from, I'm told, from some pharmaceuticals who ordered them to legitimately and legally produce the drugs. So we closed the loophole that my staff and I thought was the appropriate thing to do, and it was obvious once we read what was taking place. The DEA arrested some of these people that were manufacturing and shipping to these producers and storing these precursors, but in court they got away with it because they said, I had no idea where these chemicals were going. I wasn't manufacturing opioids, I wasn't manufacturing heroin or crack cocaine, and therefore most, if not all of them, were acquitted, or some never even went to trial. We close that loophole now. It's a reasonable person standard. No one buys or manufactures or transports a trailer load of precursors, particularly when it's done in the underworld, not knowing where it's going and what it's going to be used for. So now it makes it easier for us to go after these criminals, these thugs, who manufacture these chemicals or steal them, not only because of theft, but because of it's the same thing as trafficking drugs, and they can be punished just as well as a major drug dealer. And that's just a very nutshell interpretation of that. The next piece of legislation that I put together and we got passed in this bill, my staff does the work. They make me look good, like all of us. Our staffs make us look like $1 million. But it was a piece of legislation that involved, there was a disconnection between DEA and those companies that distribute drugs, distribute prescription drugs, and pharmacists. And those pharmacists and those distributors were facing penalties and prosecution by the DEA because of perhaps a spike in the volume of drugs that went into a state or even a county with no explanation as why there was a spike. So if I were a distributor or if I were a pharmacist and I sold on a monthly basis, let's say $1,000 worth of prescription drugs that were opiates, and the next month it jumped up to $10,000, the DEA was saying, wait a minute, you're doing something criminal here, and it caused a problem. We got that situation squared away because there are, on some occasions, a reason why there is a spike in those type of drugs being distributed. But now DEA and the pharmaceutical companies and the distributors and the pharmacists are all working together. They didn't do that before. And where do we get some of our best information without violating these crazy HIPAA laws that we have? From the distributors, from perhaps not specifically or directly from physicians or pharmacists, but by looking at the numbers that may be going to these pharmacies or being distributed or prescribed by physicians that the DEA has an authority to go to, they can, by just their federal authority, go and speak to these individuals. And there seems to be a real big difference between the drugs that are being sold last month and you're prescribing this month. But also we have discussions concerning educating our physicians, educating our pharmacists, educating the general public about these drugs, about such large quantities being prescribed at one time. And we're finding that the medical society, the physicians, the pharmacists, the distributors, since we brought the DEA in and squared that problem away, everyone now is sitting at the same table discussing the issues, and we've accomplished a great deal as far as keeping track of and finding the criminals, not classifying everyone that they're under suspicion because there's a certain number of drugs that have increased over the past month. Now, I guess at any time, if you have a question, please chime in because I'm going to switch gears here in a moment. There are grants out there. The grant money goes to the states. The states are going to have to, unfortunately, compete over this. It's not much money, as I said, when you're talking about 50 states that have this problem. And then when you break down the counties that have the problem on top of that, it even gets more complicated. So my recommendation to my colleagues in the state of Pennsylvania and certainly in my office, we cannot help you write grants, but we can give the locals, the law enforcement people who want to apply for grants, we can assist, we can advise. We can tell you what the agencies at the federal level, for what they are looking and how to put that down succinctly and efficiently to compete for this grant money. Any questions at this point concerning the...
Actually, I'm going to have you continue the testimony. Somebody wants to squeak one in. One. I'm just teasing you. I just assume you go with all your testimony,
Okay.
and then we usually question after that.
I will jump into the second issue.
Thank you, Representative Lycoming.
And if there are specifics you want to know about the legislation, you know how that works. It's detailed, it's intricate, but to sum up the legislation, money available through grants, cooperation to the federal, state, and local levels, and actually the local levels have a great deal of more input into this than just the federal and the state. So please keep that in mind. The second issue, I think, is just as critical. When I was a prosecutor as a district attorney, the district attorney works for the people who elect him or her. As a U.S. attorney, I worked for the president and then via the attorney general, and we couldn't make decisions like we could without getting permission from those individuals as we did as DA. But here's what I believe we need in the United States. And actually, I'm trying to get money. I have an appointment with the leader of the House when we go back. Unfortunately, we don't have earmarks anymore. Earmarks are a good thing if they're not abused. And we should be able to bring tax dollars, federal tax dollars, back to our state and to our locals. It's insane that we can't do that. Why let any president decide where that money goes as opposed to our legislators and at the state level? What we need in this country is certainly tough law enforcement. Violent drug dealers who sell drugs for profit. Most of them are carrying guns because I've prosecuted hundreds of them, maybe even thousands of them over my 18-year career. They have to be prosecuted to the full extent of the law. These people are not nice people. And this doesn't go across race at all. I mean, I've prosecuted just as many whites as I have blacks and Hispanics and anything else. You look at the problem here, and it is a problem for the United States. It's not a Republican problem. It's not a Democrat problem. It is not a white or a black problem. It's a problem for all of us, and I've seen it front line. What we need to do is put these people away. We need to make sure that judges are doing that. Judges make the determination of the sentences, but the prosecutors have to argue for stiff punishments. And most of the time in these cases, it's pretty evident when people come in and testify, you have the drugs, you took the gun off the individual. And in some circumstances, they're getting a slap in the wrist, both at the federal and the state level. But what we need to do to deal with the people that are addicted, and bear in mind, there are some people that deal drugs, but to support their habit, not to generate a profit. And I see this opioid problem as just as bad, if not worse, than the crack cocaine problem in the 90s. We need a prison/hospital. And let me clarify that. Say, for example, person A gets caught dealing drugs, not a violent person, not dealing for profit, looking at 5, maybe even 10 years in the federal system. And I think this is so big, we need the feds to help in this. If we had a prison/hospital where this person goes to this facility in the state or in the region, and if you were to look at it, it wouldn't look like a traditional federal or state prison, but they're locked down. There's security there, but they have 24/7 treatment on a daily basis with psychologists, psychiatrists, doctors, lay people, religious people, educators, other people who have recovered on a daily basis. And then we have a panel running and overseeing this facility who are there on site as a full-time job, making sure that treatment is given on a 24/7 basis. It only takes a couple of months, or even less now with opioids, a couple of weeks, to get addicted to drugs. If you think a 28-day program or a year in prison, whether that's in a county prison or a state prison, is going to cure it, think twice. Because it is so addictive that they're going to fall off that wagon very quickly. In addition to these people being in this facility, say they're sentenced to 10 years. If they successfully, according to the strict standards of this panel of experts, if they successfully become clean, and folks, it's just like alcohol. Once an alcoholic, always an alcoholic. Once a drug addict, always a drug addict. So it's just not sending that person out because they did well in the treatment facility where they could have done 10 years in prison, but they got out in 3 years because they did everything well in this hospital, and the board makes that decision along with the prosecutor. Then we have to make sure, even before they're out, that they're out of their environment, that we get them employed, that we get them trained before they're released. It's going to be expensive, but it's going to be far less expensive than what we are doing now. If you think somebody going to federal prison or state prison is going to be cured, come with me to a federal and state prison, and I'll show you where that's not going to happen. So we have to get to the root. We have to involve the family members. We have to make sure that that individual is not running around with the same people that he or she was when they got arrested. This is a full-time program, but I think it's probably one of the most in-depth recovery programs that we could ever implement in the United States and certainly in Pennsylvania. So if you have any questions about any of this, I'll be glad to answer it.
We got to have you come to Harrisburg. That was pretty timely. I'm impressed. First question comes from Representative Rick Saccone. Thank you, Congressman.
Thank you, Mr. Chairman. Thank you, Congressman, for your testimony. So I'm interested in the funds that are available, the federal funds. So as you know, there's a handful of states, maybe 10 states, that have the highest death overdose rate from this scourge, and Pennsylvania is one of them. Are the grants weighted toward the states that have the biggest problem?
I think to a minimum, to a certain extent, but I don't have to emphasize to you the problem across the country. It only takes one person, one parent to lose a child to this, and you can't weigh it as to whether, well, there were 100 people that overdosed. It's a child that died. But no, I think a great deal of this has to do with how the grant is prepared. Certainly, the number of individuals in a particular area is going to have some impact, but usually this money is broken down into categories anyhow. So if there's an area that has a tremendously large number of deaths, yeah, a chunk of this is going to be set aside for that. But we know how devastating this is to, right here in Lycoming County, the number of people that young people that we've seen die because of overdoses.
Thank you.
Representative Whelan, then Representative Costa.
Thank you, Mr. Chair. And again, Tom, thanks for attending today. You had alluded to the crack cocaine issue.
Yes.
And for the most part, excuse me, for the most part, it's rare that we hear about crack cocaine in Lycoming County, but we were just talking about that situation. Some parts of the United States, it's still a hot topic, a lot of crack cocaine in certain areas. But here, it's not, because I believe it's because heroin is so inexpensive on the streets compared to other forms of addictive drugs. So here's my question. You still sit on Homeland Security?
Homeland Security, Foreign Affairs, Judiciary, and NATO.
Okay. So United States government, we have a pretty good handle on where this heroin's coming from, what countries it's coming from?
We've always had a handle on where it's coming from.
Okay. But it's coming in cheap, probably no charge. And these countries that it's being grown and processed in are countries that really don't like the United States of America. And they're trying to kill a generation of Americans without firing a bullet, and they're succeeding. What is the federal government doing to help secure our borders from this free trade of heroin that's coming to our shores.
Well, two issues to address that. Before the drug gets to here, drug cartels have been paid a great deal of money, millions of dollars. I was in, not too long ago, in South America. We were in Colombia and looking at eradication of cocaine fields. Many of the people employed in, I'm going to call them developing countries, and even more advanced than developing, this is their livelihood. Clearly their livelihood, that's how they feed their families, that's how they live. The government knows this. And I give you an example of when we were in Colombia, we were in Black Hawk helicopters overlooking the terrain, and we could see just hundreds of cocaine plantations where they would actually grow the plant and manufacture the cocaine. And then occasionally we'd see a smoke plume come up. And the smoke plume was because the law enforcement entity went in for show, as far as I'm concerned, took that one out, but left 99.9% of the fields going. They had a situation, they used to use a herbicide, and I'm forgetting the name of it. It's something that we use here in our own gardens to get rid of weeds. That's it, Roundup. In fact, I was trying to stay away from the name, but fine, Roundup. They were using that, and there was a decision made at the executive level, the president's level in Colombia, that they couldn't use that anymore because it was too dangerous to the environment. Now let me tell you how they make cocaine. They dig a big trench about 50 feet by 50 feet. And they put a piece of plastic in the bottom of it. And they dump kerosene and all these deadly chemicals along with the plant leaves to break it down. And then drain that product out. Drain all of the liquid out, which goes into the ground. Let the plants dry, grind it up, and make the cocaine. So I asked one of the high-ranking officials, well, don't you think this causes more of an environmental problem than Roundup? And they wouldn't answer the question. So and yes, you're right, the other countries, this is a way of not firing a shot and taking advantage of killing us. But also what we need to do is, once again, and please, I don't want you to sound like this is all me, but because even my district attorney's office, I had a top-notch staff and a top-notch bunch of investigators, and it was called DART, the District Attorney's Response Team. And I had 8 agents out on the streets, not Monday through Friday, 8 to 4, weekends, nights, holidays. And they went out and did a massive buy-bust investigations, taking down dealers off the street right on the spot. If it was a long-term case, they turned it over to my drug task force, which took a little longer to build the case, but we sent these people away federally. We took their possessions. I took the gold right off their neck, the gold chains off their necks. We shut down slumlords places. We shut down bars that knew this was taking place. We don't seem to have that anywhere in the United States where we have an investigative unit out there meaning business. That's part of it. We're not going to solve this problem unless we let the dealers know that we're going to go out there and kick butt and we're going to put you away for as long as we can put you away. And if you know what you are selling, has something in it that is instantly going to kill somebody, in addition to the drug doing it, you should be, there, at the federal level, we have enhancements onto the charge of distributing drugs, which can add double and even triple the time that someone spends in prison. So enforcement and the idea of a hospital/prison is going to have a tremendously good positive effect on this.
Thank you. Representative Paul Costa, then Representative Gainey. I see we are joined by Representative Ellis and Durgley. Thank you, gentlemen, for joining us.
Thank you, Chairman Benninghoff. And Congressman, thank you so much for being here. I really liked your comments on the earmarks. That reminds me of when we used to call them legislative initiatives, but, and I miss them. And I still have people asking for them.
I have a real good name for them. No more earmarks. Infrastructure building. If you don't like that, let's come up with another name.
It reminded me of a comment that the president made a couple years ago that said that earmarks are a waste of money unless they're in your legislative district. But I want to get back and follow up with Representative Saccone talking about the grants. So these grant requests, do they have to come on the state level? Can they come on the county level? Do we deal with our congressmen to do this? How do we access those dollars?
My advice is that you deal with your congressman either at the House or at the Senate, or both. And the agencies that are involved in this, and I want to make sure, it's the Attorney General's office. They have grant money. The Secretary of Health and Human Services, also Secretary of Health has the money. And there was one other that I'm drawing a blank on at this point. But it's authorized to the Attorney General and the Secretary of Health and Human Services for grants. So there's two places you can go for grants. And it's a complicated process. I'm sure you know it. You know how complicated it is at the state level. But we can assist. House members and senators will assist in directing where to go, looking at the criteria, zeroing right in on the websites, and that should be a good start.
Thank you very much. I appreciate it. Thank you, Mr. Chairman.
Representative Gainey and Representative Longevity.
Congressman, I definitely appreciate your testimony. Thank you. One, I just wanted to ask you about the hospital. You talked about having a / prison hospital. I don't know about the prison, but this hospital sounds very good, particularly for those that's drug addicted. Is this a conversation that's actually happening in in Washington, or is this just your original thought?
It's my original thought that I have been talking about for some time in D.C., and now I'm at the point where I'm going to ask for money for a pilot program. Let me qualify the prison part of it. I don't care if you call it a hospital, prison, hospital. It has to be a situation where it's, it's almost an involuntary situation, but certainly people who step forward and say, I have a problem, I'm addicted, and actually I've been selling to support my habit, these people, as far as I'm concerned, should be eligible to get into this facility. But the hammer over the head of the person that gets arrested is the fact that you have a choice of going to prison, or you have a choice of going to this hospital where you're not going to be able to walk out when you want to. Okay?
When you had your DART program, did you see a reduction of drugs in the street?
You bet. In 6 months, I'm proud of what we did. We turned around this county. I even had judges that didn't like the idea that even though the district attorney was the chief law enforcement officer of the county, didn't like the idea of the DA having a team of agents to go out and do this. And when forced to bring it to light, in 6 months, felonies decreased, robberies, burglaries, assaults, significantly. And it got to the point where, and the DAs have to be aggressive on this, we went in and I took a guy's exotic aquarium where he had about $50,000 worth of these exotic fish. Now, what am I going to do with exotic fish? The only thing I did is I called a local pet shop and said, I got a bunch of fish you can have just because I want to take away from this guy, in addition to everything else we were taking away from that person.
And one more question. Do you think that we'll ever be able to incarcerate our way out of drug dealing or drug using?
Simple incarceration and nothing else?
Yes.
No.
Thank you.
We have to start. I was a big proponent of the DARE program, and someone says, well, it didn't work. Well, how do you measure how many kids didn't use drugs in DARE? And we have to start this education at the preschool level, but we also have to start educating parents, particularly young parents, in situations where they don't have a job, and they're depending on welfare just to feed their children.
Do you believe we need a public awareness campaign to begin to educate our community about the symptoms of drugs, the power of drugs, and what they need to do to stay away from drugs?
Absolutely.
A public awareness campaign, and we need money from Washington.
Yeah, there's no question. This is so big that federal
But we
money
need
has
money
to
from
win this.
Washington.
I'm here saying, yeah.
Okay.
There's no question about that.
Thank you, Representative Longjetti and Representative Keller, Fred Keller.
Thank you, Congressman, for your testimony. Obviously, a number of us are interested when you talked about the grant programs, and you've had some questions on that. I guess a general request, if this is a fair request, that perhaps as your office gets more detailed information on the grant programs, perhaps it would be something that could be shared with the Republican and Democratic policy committees in the House.
Most definitely.
Appreciate that. It looks like, just a real quick internet look at it, it looks like part of what the Act may have done is codified some existing grants that were in the Substance Abuse and Mental Health Services Administration, if I read correctly. And I know one section of it, according to what I read, expanded a grant program there specifically to allow first responders to have funds to get naloxone and to get training on how to use naloxone. Very important in my area, my small county of Mercer County, 117,000 people. Front page story today, one of my colleagues, Representative Nesbitt, had a seminar. Three of the folks that live in his small town of Gross City died of an overdose. One of my local doctors is at the forefront of the Medical Society of Pennsylvania, trying to deal with the opioid, and he called me about a week and a half ago and said 6 people died in the last 30 days in the small city of Sharon from overdoses. The police don't have naloxone. They need to get it. They want to get it. They don't have the funding to get it. So if I read correctly there, it almost sounded as though that grant might be something that a local police department could apply for. And that's the kind of information that I'm asking, we need to know. Is it the state applying and then the state's pushing it down, or is it local law enforcement that could apply for that particular piece through the Substance Abuse Mental Health Services Administration?
In my experience in getting grants, when I was a prosecutor, a DA here to get a grant, I back then in the 90s, I got a $250,000 grant that was through the Justice Department. And most of that money that's available is going to be funneled through the states as well as I can determine through the legislation. But there are always grants out there, and I think part of this money may be where someone can go to Health and Human Services or go to the Attorney General's office and submit a direct grant or a couple of grants. But I don't feel comfortable telling you exactly what to do at this point because there's still information to come out on how to go about this.
It's a relatively new act.
Yes.
Last question, and you indicated in your testimony it's a step, but there needs to be more resources. Yes. Do you foresee on the horizon, I know the federal budget is difficult, but do you see on the horizon any push to put more money into the program, particularly for treatment?
Let me put it this. There is, if we just paid a little bit of attention to the waste, fraud, and theft in D.C., in this country, the money that's unaccounted for, we could more than pay for these programs.
Okay. Thank you, Chairman.
Representative Keller, and then I'm going to ask a quick question. I know we need to get you on the road, sir, and we appreciate your time. Representative Keller?
Thank you, Mr. Chairman. Thank you, Congressman Marino, for your testimony. Just one question I have, and I'm not sure it's been thought of, and I think we need to think about this in Harrisburg too. Recently, I've had some constituents that have trouble getting help. Now, we have drug and alcohol courts across the Commonwealth. In fact, Union Counties was recognized a couple years ago by Secretary Wetzel.
We started it here in Lycoming County, drug court.
But it seems it's difficult that if you're not convicted of a crime, getting some of the help you need for treatment. Has there been any discussion on people that do like a self-admission to a treatment center and they come out to go through their program to get help with deductibles and so on?
Sure. Yes, there has, but see, I don't think it's difficult because I had a program for young people whereby if it wasn't a serious felony and they were between the ages of 18 and 28, they were arrested, and if it wasn't a violent crime, if it wasn't dealing drugs, they had the opportunity to make a decision: join the military or go to prison. And if you join the military and successfully complete a 2 or a 4-year stint in the military or in there as a career, the charges are dropped. But if you're back in the business again, we reinstate those charges, and you're going to do that, and others. Out of the people that we had in, I had one fail that, and still today I have people come to me and say, "You don't remember me, do you?" And I said, "I'm not quite sure." I said, "I was going to go to prison, but you gave me the opportunity to go to in the Army, and now I'm a lieutenant colonel."
Yeah, but well, I'm looking for people that are employed that have an addiction problem, that go seek treatment on their own, and then are they might have a health insurance plan where they work, but it doesn't help them cover some of the costs associated
Money
with
should
that.
not be a prohibitive factor in
Okay.
this.
So that discussion is taking place, and again, that's something that we
Yes.
should talk about in Harrisburg also. I just wanted to make sure that was on everybody's radar screen, because people are having trouble getting help if they have not been convicted or they've not gone through a court.
I encourage people,
appointment.
if you're addicted, and in my experience, most drug addicts know that they're addicted. I encourage them to step forward before, number one, they're prosecuted, but more importantly, before they die.
Yes, thank you.
Congressman, I just have one quick question. I apologize. I know there's lots going on. We appreciate your testimony and the
all right.
efforts going on with the federal government. Sometime you get us information regarding the cost of a federal prison, that would be helpful. My question is specific response to one of your comments, and I'm sitting here, maybe I'm the harsh one in the group, but these other countries, I see no motivation for them to cut down their industry, which they might pretend is illegal, but I suspect there's so much cash flowing with that thing that they're just turning a blind eye to it. Has there been any consideration on the federal government's level that we start shutting off other aid to these countries? Because cash they can buy stuff with, but there's other aid that they need from us until they police their own. We're never going to police it from our borders. We can come up with 1 million grant programs, but to me, those are Band-Aids. I want to shut the cause of the problem off. And maybe I'm too unrealistic, but I'm curious if you're...
No, you're not. You should see some of my comments in hearings and on the floor. I'm a tremendous advocate of, if you do not want to be a friend of or play on a level playing field with the United States, and we're funding countries that are our enemies.
Yeah, I mean, these people hate
You don't get a
us.
cent from us.
Right. Do you think we can get a majority of individuals to think like that? I mean, we're losing 9 to 10 people alone just in Pennsylvania every day, 9 to 10. That's 300 a month. If a bus wreck with 300 people, plane went down, we'd call it a catastrophe. This is crazy that we just don't tell these other countries, listen, grow your own corn, whatever it is what you want to do in these fields, because we're not sending you any more aid.
Right. The death of a person should be enough for Congress to say enough is enough. But let's look at this. If you want to, we'll look at it strictly from a financial perspective. We're about ready to hit $20 trillion in debt. We can't afford to be paying our own bills, let alone paying someone else's bills.
Well, again, we appreciate your time. I think the majority of the members up here would support you on that. Representative Whelan.
Well, again, Congressman, thank you very, very much for taking the time out. I will go out on a limb and speak for all my colleagues on both sides of the aisle when I say that you have a friend in Pennsylvania here that in the House of Representatives, and we will work with you. If you need a delegation of us at the appropriate time to come to Washington, D.C., I'm sure most members in both caucuses would raise their hand volunteering to come down and help you with your efforts on anything that has to deal with the heroin plague that has hit all of our districts. So
the heroin and our pharmaceutical problems with the legal drugs that we're addicted to. That works both ways. If we can be of any assistance, but please discuss my. If you want to put another name on it, go ahead. My hospital/type prison program, because we're not going to cure somebody who's addicted to drugs just by sending them to prison.